technique in cattle practice and has many, many uses that I won't go into here. The first and most important aspect is to be sure that the site for epidural injection is thoroughly cleaned. It's best if it's clipped or shaved, and the site that we would like to use can be appreciated here when I move the tail between the sacrum and the first coccygeal vertebra, or as an alternate between the first and second coccygeal vertebra. The first joint where you can see some movement will be the sacrococcygeal junction, and you can feel it as a little depression, maybe an area that you feel kind of compresses on your finger as you elevate the tail. That's the best site. The area is prepped. You alcohol, take an 18 gauge, preferably 1.5 inch needle. It could be done with a 1 inch needle. And then it's helpful to identify one more time with a finger. Keep the bevel of the needle either directly anterior or directly posterior. And the needle goes in nearly perpendicular, but maybe slightly anterior directed. Precisely on the midline and thrust it in. Most cattle make a slight movement at that point. And if you have some question about the disposition of the animal, it would be best to stand off to the side or kind of in a frontward position so that she doesn't kick you. Now there are some tests to determine when this needle is in the right spot. You can see that approximately 1 inch of that needle is buried. I felt that it went through some ligamentous tissue, and now it's resting just onto bony tissue, and I've withdrawn it just a very small amount. One test is to put a small drop of the local anesthetic in the needle, and if it pulls it in, as it did there, almost for certain there's an area with a slight vacuum, and that means that it's the epidural space. There I'm putting several drops in. They're all disappearing down into the needle. So that's the correct site. As for the anesthetic, I'm using lidocaine, and I'm also measuring the dose to be approximately 1/2 cc per 100 pounds of body weight. So if this heifer weighs about 600 pounds, we're going to give about 3 cc's. That will be just enough to get anesthesia to the perineum. Will not put this cow down. At that point, we'll attach the needle, stay in the same site, and make an injection. Now this plunger should almost fall in. In fact, one other test is when you're pushing on the plunger of a disposable syringe, you shouldn't blanch your thumbnail or you're not in the right spot. There it went in, then you withdraw the needle. The alternate site is at the next space, and I'll just point out where that is. Right there is the site I entered. Here is the first coccygeal vertebra, and right there would be the second site, and the needle would be thrust in right there. That's in the second site. So here's the first one, there's the second one, to give an idea about how far apart they are. The test for successful epidural anesthesia is to grasp the tail, shake it back and forth, and check for laxity. This cow has no control of her tail. She's just totally limp. Not only that, she has no sensation of pain upon pinching, and even if you get to a sensitive area like the vulva, pinching of the vulva as hard as you want raises no sensation. And then you can test the loss of sensation all the way down her rear parts as well.